So my name is Emmanuel Ho. I'm an associate professor at the University of Waterloo School of Pharmacy. I'm also cross-appointed to the Department of Chemical Engineering. So my research team has mainly been focused on developing drug delivery strategies for improving women's health. Specifically, as you're aware, in the case of HIV prevention, the most common methods of preventing HIV is condom usage. And another one would be taking what's known as PrEP, or pre-exposure prophylactic, which are basically medications to help prevent HIV infection. So our research team has actually been developing a third strategy where we kind of coin as inducing immune quiescence. So what this basically means is studies have shown, for example, there's a particular cohort of women, sex workers in Africa. Interestingly, even though they're exposed to partners that are HIV positive, these women somehow are resistant to developing HIV infection. So after undergoing some sort of some studies and some analysis, one possible reason for this resistance is what researchers have noticed is a reduced baseline immune level, basically reduced immune baseline level within the female genital tract. In other words, there appears to be reduced activation and recruitment of immune cells within the female genital tract. And HIV, the way it works is HIV needs to recognize activated immune cells for infection. Okay. As a result, then, our team has been trying to develop drug delivery strategies in which we can induce this reduced baseline level called immune quiescence. So we've been developing different drug delivery platforms. One is the intravaginal ring, which is very similar to the contraceptive rings. Right? The idea of these rings are to release drugs on a daily basis for a minimum of 1 month, for example. So what we've been trying to do is we're trying to deliver a variety of different compounds, one being an anti-HIV drug, for example, tenofovir, and even a immunomodulatory drug such as aspirin. Okay, so the reason why we're trying to develop this third strategy is because, unfortunately, due to social cultural factors, a lot of women are not able to negotiate condom usage with their partners, and sometimes they see taking PrEP, or pre-exposure prophylactic anti-HIV drugs as some form of stigma associated with it. So we can develop, for example, an intravaginal ring, which a woman can use discreetly without their partners even realizing it's there. The women themselves can protect themselves from HIV as well as other sexually transmitted infections. So really our group is trying to develop strategies in which we can empower women to protect themselves from sexually transmitted infections. I think in general, the best way to increase translational potential of any drug delivery system is to really first identify the problems that you're trying to address, right? What is the need right now in order to improve health? So for example, in the case with HIV, what we noticed was, with a lot of patients, there seems to be a lower patient acceptance and patient compliance with a lot of the medications that are out there, right? People do not want to take drugs orally on a daily basis for the rest of their lives. Okay, some people don't like intravenous injections, for example. So we can develop a system that's considered to be long-acting, where they can just either place an implant and forget about it, for a long duration. That would be the most ideal. So that was kind of the motivation for our projects, our idea. So I guess the advice would be then is really identify the problem you're trying to address, and then go through the literature and identify what people have tried. Okay, what they have tried may have either succeeded or failed, and identify and understand why these ideas have succeeded or failed. Even the ideas that have succeeded, there's still going to be certain limitations. right? So how can your new idea that you're bringing to the table address some of these limitations? So I think it's very important that researchers understand that you don't need to develop a very fancy and complex drug delivery system. The most important is you want to design a drug delivery system that works, right? Something that's effective and can improve health of patients, right? So at the end of the day, that's ultimately the goal. Because if you have something that's very fancy, very complex, but it doesn't solve your problem, really the system just ends up not being used, and there would be no utility for it, and it becomes just useless. So those would be some of the advice I would give. Yeah, so my main inspirations, I would definitely say, are my mentors throughout my entire career. These mentors can either be my graduate supervisor and my postdoctoral supervisor, as well as other researchers, even within the department. I kind of see it as, as any graduate student, you want to be able to obtain as much information as you can regarding whatever you're studying, whatever you're doing, right? So I love talking to more senior researchers, kind of understanding their thought process, how they approach ideas and questions, and so forth. So I think, I would say inspirations are everyone that's kind of along the way that kind of helped me. There isn't one exact individual or person, but I think also, it comes from the interest, I guess. You have to find an area that you're very interested in. I think that's very important. And then once you have an area that you're interested in researching and helping to solve the problems, you'll automatically be able to find inspiration either from mentors or even from other people you meet at conferences and so forth. So I would say that's where my inspiration kind of comes from. It would be everyone that I was able to interact with. For example, at the CRS conferences, there's a lot of amazing researchers there, which I enjoy chatting with them each time I see them, and I they give me new ideas, new inspirations each time I chat with them. Yeah, so because my research is mainly focused on long-acting delivery systems, the biggest challenge I think still is faced is really improving patient compliance and acceptance of drugs, therapies, I guess, because a lot of us, when we work on drug delivery systems, we want to make sure we take that into consideration when the patients are taking it, right? If, like I mentioned, if they have to take a drug on a daily basis, they're not going to remember, right? They all got lives to live. Sometimes if you're out of town, you didn't bring enough medications, or you don't remember because you're out all day. Unfortunately, when you kind of miss a couple of days of medication, that's when therapeutic effects start to drop off, right? And the problem is, depending on the situation, for example, with HIV, timing is everything, right? If you happen to not be protected, unfortunately, then you're at an increased chance of being infected with HIV or other infectious diseases. So we can develop systems that are long-acting, non-invasive. Those are the most ideal scenarios. So I think the biggest challenge now is continuously improving patient compliance and acceptance, even with younger pediatric populations, for example, right? As a lot of kids don't like taking medication. So if we can find a way to improve drug delivery to these specific populations, it would greatly improve therapeutic outcomes for these individuals. So I think that's what I would say are still going to be the biggest challenge. Not all drugs can be delivered, for example, transdermally. Not all drugs can be developed into a long-acting system. So I think we need to be creative in finding ways to be able to deliver these very effective drugs, but in a way that patients would appreciate it. Yeah, I think the main advice I always tell even my own trainees is don't be afraid to try to achieve whatever goal you have in mind, either going to academia or industry. I think a lot of young researchers, their initial goal was to become a independent investigator, right? They want to be a professor. But from talking to a lot of people, they kind of get scared away, right? They all say, it's very tough to be a professor. It's too challenging. I'm not even going to bother even trying. By default, then I'm going to go into industry. So I think that's the wrong mentality. I think that what they need to realize is if they don't try, they don't apply, how would they know that they're not successful, right? So I think whatever their goals are, their dreams, try their best to achieve it. And it's very important that they reach out to mentors, right? They don't have to be your direct supervisor. You can actually find another professor in the same department, and they could actually be a mentor as well, right? As long as someone is approachable, and they enjoy guiding you, right, in the right direction and answering your questions. I call those as mentors. So I think a lot of students are afraid to reach out to more senior professors because they're afraid the professors don't have time to give advice. The professors don't want to talk to students, but it's actually the opposite. I really enjoy talking with students. I love to share my experiences, right? I make it clear, my advice is just what I've experienced, and it could be different for you. But I think that's the most important because, if you have questions, this is the time to ask them. It's the best way to figure out which direction you want to take for your research career. So don't be afraid to talk to people. I would definitely say that's the most important.